Hello guys, welcome back to another video. If you're new here, my name is Faith. I'm a registered nurse, and on this channel I talk more about leveling up. I'm on my level up journey, especially career wise. I'm in the process of relocating from my country, moving to the USA, where I believe I'll practice better and I can practice to my fullest potential. So if you're new here, welcome. I'm so glad to have you here. Please go ahead and hit the subscribe button. And if you like this video, please give it a thumbs up. It will help my videos and it will help my channel and it will help us grow as a family. And if you are returning, thank you so much for your support. I really appreciate it. And I really thank you guys for helping me get to 70 subscribers. I'm so thankful for that. And I'm thankful that I'm helping other people. I'm helping you guys. I've been receiving some wonderful messages from you guys and I'm thankful for that. So I'm shooting this intro. I'm filming this intro a different day than I actually filmed the video, because the first time I filmed it, the intro was so bad, the quality of sound was bad. So today I'm filming the intro of this video, and guess what guys, we are talking about SATA questions. Yes, I know so many people dread when they think of SATA questions. Yeah, because before you start studying for the Nclex, people tell you that SATA questions are the worst, they're the hardest questions, and all those kinds of scary things. Yeah, and guess what? Yeah, SATA questions are hard. And another good thing is when you see SATA questions on your tests, you meet more SATA questions, you should be clapping for yourself, because most of the time SATA questions are on the higher difficulty level of the Nclex. Yeah, you might be getting them wrong or right, but they are considered among the high difficulty level questions on your test. So it doesn't matter. It shows a good thing. It shows that you are on the upper part of the graph. Yeah, you know, Nclex questions are like there is an imaginary graph, a line that if you go below, you are getting very easy questions, so you're not meeting that threshold that can qualify you to pass. Or if you get questions above that threshold, then you are good. So SATA questions are hard, but they are nice questions. So guys, let's get into the video and tackle SATA questions. And trust me, you just have to make them your friends. If you make SATA questions your friends, you'll be enjoying doing SATA questions. I used to be scared of SATA questions, and every time I got a SATA question, I used to celebrate if I get it right. So I made SATA my friend, and yeah, and there's only one strategy that I use that I want to share with you guys on this video. So stay tuned and let's get into the video. So guys, before I give you this simple way of handling SATA question, and maybe we go through some 1-2 questions with you, I just want to tell you that guys, SATA questions are among the high difficulty questions on the Nclex exam. Yeah, there are some SATA questions that are low difficulty, but mostly SATA questions are high difficulty level questions on the Nclex exam. And if you know about the Nclex, you know that you want to be getting those high difficulty questions in your exam. whether you are getting it correct or whether you are getting it wrong, as long as you don't get away from the high difficulty side of the questions, you have a chance of passing the Nclex. Nclex is not all about getting 100%. I tell you this because you have to get questions that you are receiving should be on the higher side of the high difficulty, yeah, questions of the exam. So please, a free advice that I just want to give you is, you see, when I started studying for the Nclex, I was told that SATA questions are so hard. And if people tell you things are hard, yeah, you take it literally that they are hard. So even if you meet a SATA question, you start having palpitations because you know this question is not friendly. But yes, I was freaking out every time I met a SATA question, even on my practice exams. I was like, oh my God, SATA again. It was like my maths. I never liked maths in school, so it was like my maths. So every time I got a SATA question, I will just start panicking and getting anxious. And trust me, I never used to get most of them because of the panic and that negative attitude that I had towards SATA. But then I decided to make SATA my friend. Yeah, I decided that these questions will be my best questions. And I realized that for you to be good with SATA questions, you have to be good with content. So, guys, I'm telling you this. Please, if you are planning to start this journey or if you are in this journey, please master your content. Yeah? You can't know everything. You cannot know everything. But your content, you must be good with it. Just go through a book that has the nursing knowledge content, and especially sounders. There are different books out there. There is Sleeping Court, there is Sounders, yeah. So go through these books, get good with your content, and you'll be good with SATA questions because for you to pass a SATA question, you have to know what you are looking for. Yeah, literally. Because this is just content. Yeah. So go through your content and you'll be good with SATA. Another thing that I want to tell you about SATA is change your attitude, please, towards SATA questions. Yeah. SATA questions are not terrible questions. If you know what you've been studying, and if you know this condition, you know how to manage it, you know how it presents, you'll definitely be good with SATA because that's what SATA looks for. Yeah. So just have that positive attitude because I'll tell you on my perspective, had I not changed my attitude towards SATA and just told myself these questions are hard, I don't think I could be here telling you about how SATA questions can be handled. Yeah. So just have that positive attitude towards SATA questions and you'll be good with it. Yeah. So guys, the only strategy that I used with my SATA questions is just to change that question into a true or false question, right? Yeah, and this strategy can also be applied in other questions if you want, but it works so well with SATA questions because you are giving different choices and you can't give two right ones and leave another right one and get a credit for that. You must identify all the answers that apply. So just convert that question into a true false statement. Okay, so you know with Nclex there is a positive event query and the negative event queries. Yeah, if the question is telling you that what statement from a patient shows that the patient understands about this medication? Yeah, so you're looking for a positive event query. You're looking for something that shows that this patient knows this medication. So if you're talking about, let's say, Lasix, yeah, or furosemide, if you're talking about Lasix, now you go to the answers, right? And you look for those statements that are true about Lasix, that are true about furosemide, right? Yeah, that's how you'll be able to eliminate the wrong answers from those answers that don't apply to furosemide. And if you are looking for, the question says, what shows that the patient understands information, does not understand information about furosemide. Now you'll go to the answers and look for negative event queries, right? Those questions, the answers that shows you the patient does not understand, the answers that you will answer with a no. Those are the answers that now will apply to your questions, to your question, and those will be the right answers. So it is basically that, right? With SATA, know your content and change the answer into a true false statement, right? And understand the question, what the question is looking for. Is it a positive event query? Is it a negative event query? And by positive event query and negative event query, I'm talking about positive is something that is true, yeah? Something that is, yeah, true. And if it is negative, it is something that is not true, right? And we'll go through some two questions, the positive and the negative event questions, so that you will understand. I'll be extracting some two questions from a Sounders textbook, and then we go through them and we understand. So that is it, guys. You want to be friends with SATA, know your content, be confident, and change those questions, the answers into a true, a no, yes question, right? Yeah. So let's go through some two questions for some two SATA questions, and you'll see how these things apply. Okay, so guys, we have here a question. It is from Pearson View, a textbook called Pearson View and something, Nclex. Yeah, so this question is from the maternity side, and it says, the nurse notes that earlier in the shift, the fetal heart rate was 140 beats per minute, and the baseline has now risen to 170. The nurse should investigate which factors as possible causes for the higher baseline reading. Okay, so according to how I taught you the other time, we go through the question twice, right? The first time you go read it word by word, and then the second time we are reading it as we look for keywords, right? So the second time now, the nurse notes that earlier in the shift, the fetal heart rate was 140 beats per minute, and the baseline has now risen to, okay, the baseline has now risen to 170. The nurse should investigate which factors as possible causes for higher baseline reading. Okay, so after we read the second time, we've seen our keywords there. And now we go to the answers. Read the answers without looking at the questions. Now, the first answer is maternal fever. The second one is narcotic administration. The third one is fetal movement. The fourth is uteroplacental insufficiency. And the fifth is fetal distress. Okay, so those are the answers that we have. So we now ask ourselves, which kind of question is this? Okay, and of course right now we are dealing with a SATA question. Now, from the strategy that I told you about the SATA question, you change this question into a true-false statement, right? Now, our question, we turn it around and ask ourselves, what are the factors that causes a higher fetal heart rate baseline reading, right? Now, every time we are looking at these answers, we are supposed to be asking ourselves a question that we'll be answering with a yes or no answer, right? So, let's look at the answers. Does maternal fever increase the baseline of fetal heart rate? Yeah, I think that is a yes. Yeah, maternal fever generally increases the fetal heart rate. So we go to the second answer. Does narcotic administration increase baseline fetal heart rate? So narcotics are CNS depressants. So I will say that they decrease the fetal heart rate instead of increasing it. So the answer to this is a no. This was a yes. This is a no. It doesn't. So now we go to the third answer. Does fetal movement increase the fetal heart rate, the baseline fetal heart rate? I will say no. Fetal movement temporarily increases the fetal heart rate, but it doesn't really increase the baseline fetal heart rate. Look at the keyword. Okay, so I will say this is a no. Then the fourth answer is uteroplacental insufficiency. Does uteroplacental insufficiency increase the baseline fetal heart rate reading? I'll say no, because we have insufficiency of blood to the placenta. So definitely it will lower the fetal heart rate. So the answer to that is no. Now, does fetal distress increase the heart rate, the baseline reading? Okay, for me I'll say yes, it increases. If there is fetal distress, the baseline fetal heart rate will go up. So I'll say answer 5 is a yes. And remember, guys, for this question we are looking for yes answers. This is a positive event query. Is that the correct spelling? Yeah, this is a positive event query. I don't know if that's a correct spelling. So this is a correct positive event query, and we are looking for the yes answers. Okay, now our yes answers that we have gotten as we analyze this question are 1 and 5. Those are our yes answers. So the correct answer for this question is 1 and 5. That's how you handle SATA question. I will only do this one because I've been looking for a negative event question and I'm not getting one, but I'll be doing several in the next coming videos so that I will keep using these strategies as we go along with this Nclex question series. So stay tuned for that, for more questions as we tackle them. And the answer for this question is right here from the textbook that I extracted it from. The answer say an increase in fetal heart rate baseline, which was our keyword, can be an indication of fetal distress as well as maternal fever. Those are the answers 1 and 5 that we took. Narcotics may increase the short-term variability but do not affect the baseline. Fetal movement will create an acceleration of fetal heart rate but not the baseline. Uteroplacental insufficiency causes late deceleration. Okay, so that is the answer for that question. That's how you use that strategy for SATA question to handle a SATA question. Okay, I hope you found this helpful, and let's get back into the video. Okay guys, thank you so much for watching. This is among my shortest video. I don't know if it's short. Yeah, but thank you so much for watching. I hope you learned something today, and I'll be here telling you more about the Nclex. If you like this video, please put your thumbs up. Click on the thumbs up button, and if you also don't like it, please comment in the comment section so that we can hear your views. And please share this video to those people who want to learn more about these questions, learn about the Nclex, and who are interested in such videos. Please share them. And thank you so much for watching. Please subscribe, put on the notification bell so that every time I post a video, you don't miss out. Yeah, so thank you so much for watching today. Part of this video I've not used my microphone because I feel like it has some weird noise. So I hope the sound of this video is good. I hope it's good. If you know a brand of a microphone, I'm using this. If you know a better brand, please recommend it for me so that I can make your experience better and good on this channel. Thank you so much for watching, and see you in the next video. I'll be talking about prioritization question. Stay tuned for that. Bye.